All right, we're here with Doc Positive and Ballpark Frank. Ballpark Frank's our little wiener dog here that I picked up on Friday night from a client. And Frank here, we're actually calling him Parker for Ballparker. Frank, little wiener dog, hot dog. He's got some problems, and that's how I wound up with him. He's a cute little guy, but I've never seen a ugly little dachshund puppy. But the problem with Parker here is he has an issue with his tail. He basically has a tail that doesn't function. It's dead at the base of the tail. But he also has, I'm going to try and show you here. Kimmy, can you give me a hand here? And hold him still for a sec. I want to try and show people. But in the back here, he's got no anal tone. Maybe you guys don't want to see that and stare at that, but he has no bowel control and he has no bladder control. What I think probably happened is I think that there's a good chance that he was being born breech, backwards, ass first, whatever you want to call it, and that when his tail came out of the birth canal, that the people latched onto the tail and attempted to pull him from the birth canal, which is a good idea. You know, get him out of there if he's stuck. You can't have him stuck in the birth canal, but if you pull a little too enthusiastically, they disrupted the nerve roots to the tail, and I think they may have also done some damage to the nerve roots for his anus and his bladder, because he dribbles pee, he poops. Not that dachshunds are known for being particularly potty trained to begin with. They are a difficult breed to house train, but they do house train some. Parker here, he walks and drops. It just falls out of him. The reason we're giving him a shot is because he's probably about 9 or 10 weeks old, and we're thinking that cute little guy like this deserves the benefit of the doubt. So, Parker, yeah, Parker, yubby, 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 yes. And he can't even wag his tail. But he is scheduled for some massage therapy today at 1. Compliments of Dog Star Energy Center, our friend Violet Albano. All right, we're here with Doc Positive and Violet from Dog Star Energy Center. And Violet heard the story of our little wiener dog friend here, Parker, with no anal tone, no bladder control, injury to his tail. And so she is actually here just starting some canine therapeutic massage on Parker. I don't know if you guys were watching him earlier. He was like a lunatic. He was running around. These dogs immediately pick up. I used to think this was a lot of hocus pocus, but they pick up on Violet's energy. He's laying there. He's letting her,
Look at that.
you know, start some massage, some basic techniques on him. This is all, oh, look at him, he's so cute.
He's adorable.
But Violet has been doing this for longer than she cares to admit. But she stepped right up and volunteered to help us out with this little guy because he's probably 8, 9, 10 weeks old. And if we can give him some bowel control, bladder control, and so forth, he definitely has a chance for a long life ahead of him. If he doesn't have bowel control or bladder control, hey, he'll be just like every other dachshund then. So that's not really a fair comment, but dachshunds are not known for their potty trainability. So, all right, more to follow. All right, we got Parker puppy. Parker's first ride in the sidecar. and we're headed to his first physical therapy appointment with Dr. Crabtree up at Barton Heights. So we're going to see what she can do for Parker! Yes, buddy! Yes! Want to go for a ride? All right. Check it out. All right, Doc Pawsitive here. We just sent Parker, Ballpark Frank, off with Dr. Helen Crabtree here at Barton Heights. She's getting him set up for some laser therapy. And like it shows here, we got the laser and what it does within the body and all the different mechanism of action, you know, anti-inflammatory, increased metabolic activity, reduce scar tissue, faster wound healing, improved nerve function, improved vascular activity, and anti-pain. So we're prepared to give Ballpark Frank the benefit of the doubt, give him as much advantage in the healing department as we can, and we'll see what happens. All right, Doc Pawsitive here at East Stroudsburg Veterinary Hospital, and hey, we're getting ready to take Parker the Barker to his first acupuncture appointment. He's down here. Check it, Parker! What's up, buddy? He says, I am so excited to be going for acupuncture. He says, let's ride. We're heading on up to Plains. We're leaving here from East Stroudsburg Veterinary Hospital. We're headed to see an acupuncturist that we were referred to. Parker gets massage therapy. He gets laser therapy. He gets acupuncture. Heck, I don't even get all this stuff. But whatever we can do to keep him going and get him some bowel control and bladder control and an awesome new home. So more to follow. Bye now. Doc Pawsitive and Parker the Barker. We made it. We're here to see the acupuncturist. So filled out some paperwork and just waiting for him to call us. Came out here, expressed his bladder, and we'll have more to follow. Bye now. Has something grown out of his head here. Oh wait, that's an acupuncture needle. He's loving this. Yeah. Oh, his antenna. Cool. Parker.
You got one more, and then we'll let you go, buddy.
You can see the placement and
one more, little buddy. Always says, "Forget you."
Doc Pawsitive has known all along that Parker the Barker here, the little Ballpark Frank, is definitely food motivated. He's a bit of a food guardian, so we've had to kick his ass a few times, even with the big dogs, because he gets a little food protective. So. But we're keeping him distracted here while the needles do their work and give him some distraction. So, like I always say, we try not to reward inappropriate behavior pattern unless we need to. So, but let's check it out. He's being pretty tolerant at this point.
Hey, I'm all for bribing.
But if you guys remember, this is how we trained Nutty Buddy on the treadmill with food. This is how we trained Blanche Dubois to ride in the sidecar with food. So, as I always said, puppies live for three things: food, praise, and sleep. Parker, you want to take a nap? All right, Dr. Kristen Edwards here, and Parker the Barker. Look at that, man.
Sleeping.
He is lights out. Lights out.
That's good.
I can relate, because when I had the acupuncture, I'm whispering now. You guys know it's awful hard for Doc Pawsitive to whisper. I'm usually the loud one in the crowd, but we're grateful to Dr. Edwards here. We're going to be back next week and see what happens. Bye now.